In this documentary, you're going to learn how schizophrenia affects the everyday life of patients who are diagnosed with this illness. You will learn the side effects of the illness, medications that can be used to help control the symptoms, and much more.
Well, we utilize the Diagnostic Statistical Manual, DSM-4, hopefully soon will be 5 in 2013. And there is a set of criteria in which the patient has to have had psychotic-type symptoms for a period of 6 months or longer to actually get the definitive diagnosis.
Schizophrenia occurs when the decomposition rate of gray matter in the brain is sped up. The average healthy teenager will lose about 1% of gray matter tissue each year from the parietal region of the brain. But in someone with schizophrenia, they can lose up to 10% over the course of 6 years. This illness also causes the patient to have enlarged ventricles in the brain, impaired cognitive function, and decreased prefrontal brain function. Psychotic symptoms of schizophrenia can include delusions, hallucinations, bizarre behavior, disorganized speech, and negative symptoms. Delusions are fixed false beliefs. Hallucinations consist of hearing, seeing, tasting, smelling, or feeling something that isn't there. Bizarre behavior is where the patient behaves in a way that seems inappropriate or strange to other people. Disorganized speech is when the patient speaks in a way that is difficult to understand. And negative symptoms include lack of motivation or interest, diminished cognitive functioning, and decreased emotional expression. Schizophrenia has many effects on everyday life, but when a family member has this illness, it can play a big toll on the family.
Schizophrenia is a chronic, debilitating illness, and it has a big impact on the family as a whole. If it is a parent who is affected, it would definitely interfere with their ability to parent the child, perhaps form attachment and bonding, and the parent may appear odd or unusual, which would be difficult for the child in school settings and other kinds of settings. Schizophrenia that affects a child can really take over the family. The child may need to be hospitalized and have a variety of special needs that take a lot of time away from other children in the family.
Schizophrenia makes it hard for people to do things that normal people would consider to be easy. This illness makes it hard for the patients to do things as simple as making crafts. As you can see in the pictures, something as simple as stringing beads, painting a picture, or coloring a pencil holder can be a very large task for someone who has this illness. Although there is a genetic component in schizophrenia, we have not been able to isolate this illness to a specific gene, although that research is currently underway. Schizophrenia will cluster in families, but it is not strictly inherited. Research tends to suggest that this illness is more prevalent in men than women, with women developing at a rate of approximately 50 to 75% of that of men. Because schizophrenia does have a genetic component, that does not mean that a set of identical twins will both have schizophrenia, but there will be a 48% chance that both children will develop this illness if they share a parent with schizophrenia.
What we think happens is that people have a genetic vulnerability to developing schizophrenia, and there can be certain things in their environment or traumatic experiences that will be the tipping point for the development of the illness. The one I see the most often is substance use, even a single use of marijuana or other street drugs can be the factor that is the onset of the schizophrenic illness. Although we do know that tracing back, there will be a genetic vulnerability. I'm a psychiatric nurse practitioner. I'm utilized predominantly in the same way that a psychiatrist is. I run medication clinics where I see people about 15-minute appointments to manage their medications, so I write a lot of prescriptions and evaluate them on how they're doing.
Schizophrenia hinders a person's ability to function in everyday life with things such as holding a job for a long period of time, having friends, and being able to form relationships with others. While working with some of the patients, it became apparent to me how this illness does affect the way that the patients do very simple tasks like making a bracelet, and how much harder it is for them than it would be for a normal person.
Schizophrenia is an illness that robs people of much of what we consider normal experiences in our lives. being able to interact socially, being comfortable in social situations. You often see a drift downward in social skills once the diagnosis of schizophrenia is made.
The hallucinations that the patients have can make it very hard for a patient with schizophrenia to trust someone because they aren't sure how to explain to the person what is happening, and that they think when they tell them about their strange perceptual experiences, they aren't going to believe them. While I worked with some of the patients, it took many sessions for me to finally gain their trust. But once they got to know me, they were eager to do crafts. One patient would arrive at 7 every morning that I was scheduled to come, even though I don't arrive until 8:30. I had met this patient before and had already formed a trusting bond with them, so they were always eager to work with me. When I worked with the patients, it took me several weeks to gain their trust. When they entered the room for the first time, I had many patients who would walk into the room and walk right back out because I was someone that they didn't know and was in their environment. After several weeks, all the patients began to work with me and do crafts, but it took many sessions before they felt comfortable talking and working with me.
Psychotic symptoms such as hallucinations and delusions are hallmark symptoms of schizophrenic illness. In addition, there are a variety of other things that we look for in making the diagnosis. One of the other things that is very common is a change of affect, meaning the facial features take on a flatness or a lack of normal emotional response. I am a board-certified psychiatrist. I hold a medical degree from Indiana University and completed a 4-year residency in psychiatry. In my practice since residency, I have specialized in treating psychotic disorders such as schizophrenia, bipolar, and schizoaffective disorder.
There have been many medications that have been created for the purpose of managing the symptoms of schizophrenia. The older medications, or typical antipsychotic medications, such as Thorazine, Profenazine, and Haldol, were very effective in symptom control, but left the patient with many side effects. The newer medications, or atypical antipsychotics, are now used because they have symptom control and also have less side effects.
Earlier the onset of the diagnosis, typically the worse the prognosis is for the long term. With that being said, an early diagnosis and early treatment and keeping a person on medications resulting in a quick resolution of the psychotic symptoms actually improves the prognosis.
The hallmark difference between bipolar illnesses, schizophrenia, and other illnesses has to do with psychosis. In schizophrenia, the psychosis occurs regardless of the mood, but in a disorder like bipolar, the psychosis is a component of the mood. So the real difference involves around determining whether or not there are a lot of mood problems associated with the disorder.
I wouldn't say there's one specific medication. Everything since Zyprexa is considered an atypical antipsychotic. The atypical or the newer medications are considered preferred because of a reduction in side effects. We didn't know when these medicines first came out that there was a high incidence of diabetes and metabolic changes that you can see from the medicines. The newer medicines focus on less weight gain and less metabolic changes the patient will go through. So it's almost always an atypical antipsychotic. I use a lot of injectable medications because I find that non-compliance with medications is a big problem in this patient population.
The types of things that are visually apparent from schizophrenia are often related to side effects of the medication. It is not uncommon to see hand tremors and other stereotypical type movements in people with this illness. Schizophrenia itself has been shown to have effect on brain development and fine motor skills, but the majority of the side effects that would be seen by others are because of the medication.
We used to think that the only treatment was medications. Our thinking has evolved significantly in trying to treat the whole person as well as the illness. Patients do respond to a variety of types of therapy that help them to cope with the symptoms of schizophrenia. one of the changes in the way I think about schizophrenia treatment over the years is that we don't want the medications to make things worse for the patient, meaning that too much medication may control all of the psychotic symptoms but leave the person with so many side effects from the medication that they can't function normally. Things like drowsiness, weight gain, extreme tremors. So the treatment now the treatment now that I prefer is enough medication to give pretty good symptom control, and then using cognitive therapy and other types of therapy to help the person deal with maybe the residual symptoms in an effective way.